The Blaine Young Show, weekdays from 3 to 5 on 930 WFMD.
And you and the patient, that riles a lot of people. And another thing is rationing, for instance. Like I told you, I was in England. If you smoke, you cannot get a bypass. You cannot get an angioplasty. And I think that's terribly wrong.
Even in America here, if you're 64, you can't get a bone marrow transplant.
Right. Well, but bone marrow, that's extreme.
What you just said is a fact, right?
Yes.
It's a fact. It's not misinformation that we're putting out.
No. In England, they have a set of, in fact, I gave you that report. It was called Denials and Delusions. The fact is, in obesity, if the primary care physician in England says you are not capable of getting a bypass, you won't get it. And it's very hard to appeal that. Now, they only bypass 300 per million. We bypass 2,200 per million. And a lot of people die waiting for that bypass surgery. But the end game in England is to cut costs. Remember, it was a 50-year experiment. And they never stopped it because now they cannot afford anything else because they've gone bankrupt.
But how is that different from when you have an insurance company that denies you coverage?
Absolutely.
I have tracked down medical directors. I've talked to the postal director in Florida. I mean, I cussed her out at 10:30 one night when she called me back. She said, it's an expensive procedure. The child's sick. We're not going to do it.
Absolutely crazy. That's a horrible thing to do. Now, we're 100% against that. We believe right off the bat, every doctor believes every person in this great country, regardless of their pre-existing problems, have to have health insurance. That's the insurance companies being greedy. And I'll tell you, Blaine, I was very honest with you. I think the insurance companies make too much. They made, like one company made $680 million this quarter. And that money came out of your health care. Now, one of the parts of the new bill is they're saying only 15% of the profit should go to administrative costs and profit. I think that's a good idea. You have to limit, I think, how much profit you can take out of a patient. Because right now in Medicare, we already are regulated. I get $6 for an EKG. I can bill $1,000. They pay me $6. Medicaid, a bypass surgery, 6-hour procedure, $800. Columbia University. I talked to my colleagues there before I came to my show. So we're regulated. Insurance companies need some regulation because that's where you will bring down the cost, make it reasonable. The second group of people that you need to address is the pharmaceutical companies. They've pledged $80 billion over the next 10 years to reduce costs. I think they can do a little better. I also think the American government can negotiate prices 150% above the cost from the neighboring companies such as Canada. I remember I told you about Lipitor, right. Maybe $1 there. Well, maybe you can't charge more than $1.50
Again, we're talking about buying power.
Buying power. It's like we're the Walmart. Think about it. They're the Walmart right now of healthcare. They can get insurance rate that she and I can both get. The same price, same policy, as my brother does who works for the federal government. Why should I pay 40% more to my brother who lives literally 40 miles away from me? I don't think it's fair.
Well, explain to me and to the viewers.
Let's take a quick break first because it's 4:20. Real quick before we take a break. Was the death panel for real or is that misinformation?
No. The death panel is really, it's the committee of 5-member committee that will actually set up end-of-life guidelines. And in England, they call it the death panel. It's being sarcastic, but it's a panel that will ration care define end-of-life treatment. So,
but it's for real.
It's for real.
And that's the kind of stuff that scares the holy bejeebers right out of me.
But that's what that's why I like to have Dr. Virtarello. I mean, everybody keeps talking about misinformation. I don't think the chief cardiologist at Frederick Memorial Hospital is going to come here and put out misinformation.
It's called practice guide. And what they do is they call it, it's a very sterile term, it's called practice guidelines.
The politicians have no clue what they're talking about.
No.
They need a crash course in insurance.
Let's take
or medicine.
A quick break. I want to thank 4 Outdoor. I want to thank Joe in the studio, Dr. Vitarello, Anita, Frank in the basement, Dr. Vitarello. Let's take a quick phone call. Woodchuck, welcome to the program.
Hi, Blaine. Hi, Anita. Dr. Vitarello. It's all about you, sir.
Thank you.
I have a question of ethics, and I'd like to make a little bit of a statement first, and then I want to get to the ethic issue. Last month I saw President Obama. I saw him speaking on TV, and very compassionately he talked about encouraging people to go to hospice when the time, you have to make decisions that are going to be tough. This week I watched him say, I ain't pulling the plug on Grandma. So I assume, he's redacting some things. But the ethics question I have for you is, you take an oath, and it's called, the Hippocratic Oath?
Yes, sir.
Let's say I'm 75 years old, and I've been sopping up, full benefits from Social Security and Medicare and Medicaid, and I wind up in an emergency room, and I need bypass surgery to save my life. how you come and attend to me and see me, and you prep me to go to surgery. How does the government stop this with this 5-person panel? I don't understand, because I know you, and you're going to say, well, no. This man's getting this surgery.
Yeah, they take my, it's very straightforward. They take my power away. And I just talked to colleagues in England when I was there last week. And what happens is a state, the federal government, establishes guidelines on who can get bypasses. So, for instance, after the age of 64, now you said you're 75 when you hit this door. After 64, your physician can deny you bypass in England. And if they pass, they call practice guidelines. It's a very sterile term, and it gives you an age, qualification of the patient, and say, okay, let's make it up like in England. After 64, you might not get a bypass. If you smoke, you're not going to get it. If you're obese, you're not going to get it. So if the government passes panel decisions like this, okay, and they say they draw the line at 70, and you're 74, you don't get it. So I lose my power as a physician to get you that bypass. What they do is they pretty much take the oath that I took when I graduated medical school and just take it away from me. Like the Pledge of Allegiance, it means nothing anymore. It's been replaced by a bureaucratic decision to limit your care. And that's what we all have to fight about. And I think that's what you're seeing right now. The anger out there is right now say, oh, you know something? I'm a little overweight. I'm a former smoker. I smoke. You know, I want a hip replacement when I'm 75 years of age. I worked my whole life. How can you say you're going to take that decision away from my doctor?
So if you're healthy at 75, you'll be able to get a bypass, whether you need it or not.
No, and in England, you don't get it. They only bypass 300 out of 1 million people. We do 2,200. So what they're doing is they're rationing care. They're going to limit it and take that decision power away from the physicians. Insurance companies, you can say, hey, Dr. Virtarello, how about insurance companies? Oh, well, they let you do the bypass. And in 30 years of experience, there's never been one insurance company that says you cannot bypass that patient. They won't, because they'll get sued. And that's the truth. But they're not that horrendous. But if you have practice guidelines, then they can take those treatment options away from you, like dialysis after the age of 70. They can take that away from you. You won't be dialyzed, and within about a week you'll be dead. So I think it's got to be between what the physician...
But I thought dialysis was exempt from everything. I thought you could not deny anybody dialysis.
No. Here in the United States you can't, but if you have in socialized medicine...
That's what I want...
That's where we're heading up. That's what I'm saying. If you get this public option and the government controls it, then you will have a government-run panel that would tell you practice guidelines of what you can do and cannot.
Well, let me bring this up. Hey, Woodchuck, thank you.
Wait, you're scaring the hell out of me. I got to get a
Well, but wait a minute.
Go take a couple hey, Woodchuck, go jogging. See you later.
But just so that people know, here in the United States, if you need dialysis, you get dialysis.
Absolutely.
Nobody can deny you renal dialysis.
Now, I just got an email from the Frederick News Post columnist Catherine Hilbrand. Said, FYI, from factcheck.org regarding the so-called death panel. See highlighted section below. The fact is that it will increase Medicare costs is something to be concerned about, not about the fact that patients can access professionals to make decisions about about end-of-life directives. How this got so twisted beyond me. Oh, that's right, the P word. She highlighted here, and in any case, we find no language in the bills before either House or Senate that would have government officials making determinations about which patients are worth the cost.
Well, what they're saying is the IMAC committee, the committee they're doing is going to have 5 physicians now. And they'll say they're not government officials. They get 5 physicians. Who they get them from, we don't know. But we don't want to take the power of decision-making for all our patients and limit it to 5 people to make that decision. So it's not a government official. It'll be physicians that will be recruited by the government to make certain guidelines. Like Cleveland Clinic is a big player. But
it is a death panel.
Well, in a sense, if you can't give someone dialysis and you need it and you're 75 years, and in fact, you're facilitating someone's death.
But is that part of the bill?
It's a panel of 5.
Yeah, it'd be panel of 5, and now they're trying to hide that a little bit right now. But if you heard about the end-of-life testing he's talking about, end-of-life testing, what he's saying is, we have to stop this end-of-life testing, all these unnecessary tests. Well, who needs these tests? I mean, who's going to determine who needs those tests when you're dying? A bureaucrat in the government accounting office? Or the public health department in Arizona? It's got to be the physician at the bedside. And what they're doing is they're removing the physician further and further away from treatment options. And that's not fair. And that's where I think most people are frightened about what was the experience that people had in England, okay, and how it translates to the experience that can happen in the United States.
But people in the United States are scared because you've got so many options out there, bills out there, people. You've got one congressperson saying illegals are in it.